Warden Vanderwall, we're now live.
Okay. Good morning, everyone. Welcome to our Frontenac County Council meeting of Wednesday, May the 19th, 2021. We will call the meeting to order. Do we have a resolution for that, or?
No, Warden Vanderwall, there's no addendum today, so
Okay.
we're just going to move to disclosure of pecuniary interest.
Okay. Is there any disclosure of pecuniary interest or the general nature thereof? None recorded. Adoption of the minutes.
Moved by Deputy Warden Doyle, seconded by Councillor Smith, resolved that the minutes of the regular council meeting held April 21, 2021 be adopted.
Any comments or questions? All in favor? Carried. Deputations and presentations. We have Susan Stewart with us, Director of Family and Community Health for KFLNA, to do a presentation. Susan?
Oh, there we go.
Hey, good morning.
Morning, Ron.
Good morning. I can't get my camera going. That's being controlled by the host. But good morning. My name is Susan Stewart, and I'm the chair of the KFLNA Community Drug Strategy, and as noted, the director of the Family and Community Health Division of KFLNA Public Health. And it's my pleasure to present to Frontenac Council this morning on addressing opioid-related harms through the decriminalization of people who use drugs. I do have a presentation this morning, so I will start sharing my screen. And does everybody see the presentation?
Yes.
Okay.
Yep.
Okay. There we go. Okay. So opioids and its analogs have been used therapeutically and recreationally in Canada and around the world, probably for thousands of years. And in Canada, we have a policy framework that has regulated opioids, such as opioids that would be prescribed by a healthcare provider, often for pain relief, such as codeine or morphine. And we have unregulated forms, such as fentanyl and carfentanil. We are in the midst of a COVID-19 pandemic, but we also have a shadow pandemic happening at the same time of opioid overdoses. And you can see in this figure that in Ontario, in the first 9 months of 2020, we had over 1,600 deaths due to opioids. The pandemic has resulted in the COVID pandemic has resulted in increased stress and fear and anxiety in our community, and that has resulted in more drug use. And we're seeing that across substances, alcohol, tobacco, and cannabis as well. And we're also seeing an increasing toxicity in the unregulated drug supply. As organizations have pivoted to implement public health measures in their programs and services, it has resulted in barriers in accessing harm reduction and treatment services for people who use drugs. And physical distancing requirements and messaging means that more people have been using alone. And you can see in
Susan?
this graph. Yes?
Your slides don't seem to be advancing.
They're not advancing? Oh, maybe it's showing a different, okay, maybe it's this screen. Do you see that?
Oh, there you go. You're in sync now. There you
Okay,
go.
sorry, I
Thanks.
put it on presentation mode, and so in mine, it's moving ahead, but it's not linked to what I'm sharing. So sorry about that. Thank you, Dennis, for pointing that out. All right, so we're seeing some trends from the COVID pandemic in terms of people using alone, people feeling more stress and anxiety and increased toxicity. The result of all of that is that in the first 15 weeks of the pandemic, in Ontario, there's been a 38% increase in opioid-related deaths, and that's an average of 46 per week. And as you can see, most of those deaths were people who were using alone, and so there's no opportunity for resuscitation efforts. It would be nice to think that this is really just a big city issue, you know, Toronto and Vancouver, the cities who are dealing with the opioid crisis, but that's simply not the case. We're seeing that this is happening in not just our large urban centers, but our medium and our small urban centers, and also in our rural communities. And in all of those settings, we're seeing that there's been an increase in opioid-related deaths since the start of the pandemic. Opioid use in our community and associated opioid morbidity and mortality is a very, very complex issue. And complex issue requires multifaceted, complex solutions. The KFL&A Community Drug Strategy Advisory Committee has been working collectively, collaboratively to find collective actions to reduce the harms associated with substance use. We currently have over 35 members, including people with lived experience on the advisory committee. What has become evident from not just the conversations at the table, but also from the evidence at hand, is that when we stigmatize and criminalize people who use substances, we prevent them from attaining the care and resources that they need for optimal health. People who use drugs are one of the most stigmatized groups in our society, and professionals who work with people who use drugs see this every day. Given the number of deaths due to opioid overdoses, we need to find policy options that help to destigmatize and decriminalize people who use drugs. We need to find policy options that, at a bare minimum, do no harm. Decriminalization provides us with a different path forward, a more constructive path forward. Decriminalization is a suite of principles, policies, and practices that shift the focus away from the substances and back onto people. It positions substance use as a health issue, not as a criminal justice issue and not as a moral issue. And it helps to reduce the stigma of people who use drugs. To be clear, decriminalization is not the same as legalization. In a decriminalization policy framework, people who have and use a small amount of personal possession of drugs wouldn't be subject to criminal sanctions. However, the sale and trafficking of drugs would still be illegal and would still result in criminal sanctions. The good news is that Canada is already moving towards more supportive policies. We now have consumption and treatment services sites across Canada. We have the Good Samaritan Drug Act, which doesn't penalize anybody for possession of drugs should they call 911 in case of an overdose. We have needle exchange programs, naloxone distribution. So decriminalization is in keeping with this forward policy momentum. And decriminalization is not a new practice. It has been implemented in other countries in the world, but it's recently gaining national attention. I'm sure everybody's heard of the decriminalization discussions that are happening in the city of Vancouver, and it's supported by the majority of Canadians as well as a policy option. So why decriminalization? It is an evidence-informed approach. When you look at the 30 countries who have implemented some form of decriminalization policy, what you also see is a decrease in drug-related harms, disease, and death. It does not increase drug use or drug use-related harm, and it reduces the stigmatization of people who use drugs. And that promotes access to harm reduction and healthcare services, which helps prevent overdoses. Current approaches don't promote health or well-being of people who use drugs, and in fact, they discriminate against people who use drugs and disproportionately harm our low-income and racialized communities. And organizations from a range of sectors across Canada have supported decriminalization. This slide is not an exhaustive list of the support, but is meant to show that there's quite a depth and a variety of organizations that do support decriminalization from a variety of sectors. There we go. So I am here today on behalf of the KFL&A Community Drug Strategy Advisory Committee to ask Frontenac County Council to support our statement of support for the decriminalization of people who use drugs. And this is in keeping with the current strategic plan for the county, particularly as it relates to strategic priority number 3, about coordinating championing, coordinating collaborative efforts. People who use drugs in our communities are our friends, they're our families, they're our neighbors, and they are the most vulnerable citizens that we have. And we have a collective responsibility to help. We have a collective responsibility to support. I'd like to read a quote from the coordinator of the Consumption and Treatment Services Center located at the Integrated Care Hub. And the hub has seen over 250 overdoses in the last 8 months. And the coordinator said, if anyone has any doubts in regards to decriminalization, come and spend a day at the CTS. Come and hear from folks who have been stigmatized, demonized, criminalized, and have also lost people due to overdoses. Come learn how this policy could impact lives and open up a variety of possibility for folks. Folks are disheartened and discouraged by barriers of having a criminal record. Endorsing the statement of support for the decriminalization of people who use drugs puts us all on a path that will lead to better solutions and better outcomes for people who use drugs. Adding your voice to the chorus of people who are already calling for decriminalization will send a clear message to the community that you care about the people who use drugs who reside in Frontenac County. Sorry, it's hard with so many screens. Moving back to my presentation. I have many people to thank in the work that's led up to decriminalization statement and also for this presentation. And I'm open to take any questions that you may have.
Thank you, Susan. Deputy Warden Doyle.
Yes, thanks very much, Susan. Excellent presentation. We've been working this file for many years at the health unit, and Susan has been leading it, doing a stellar job. And we've concluded there that this definitely is not a primarily a legal issue. It's a health issue, and we have to do something. Portugal, I think, was the country first at the criminalization, and they're way ahead of us, and another 30 countries have joined in. So we want to be part of that group, and I hope Council will support the resolution that's coming up later in the agenda. So if anybody else has got questions on it, I should also say Susan are on a campaign going around to meet our local 3 MPs in the region of KFLNA. And I think tomorrow we have our first appointment with MP Scott Reid. And the following week, our Kingston area and the Islands MP, Mark Gerritsen. So we're hoping that other health units will do similar. So we're kind of leading the charge here. Thank you.
Councillor Smith.
I just want to say that I totally support this resolution. In my previous job with Hastings County, I was involved in harm reduction committees and needle exchange programs. And the whole drug issue is in our communities. I know our firefighters have gone to calls where they've had to bring someone back. So it's not a city issue, it's all around us. And I think I certainly have been affected personally by this. And I think we need to support it and all work together to save some lives.
Thank you. Councillor McDonald.
Yes, thanks through you, Mr. Warden. Susan, I support this motion also. I'm just wondering if there's been any studies done that the amount of healthcare dollars that would be saved if we happen to get this pandemic under control. Do you have any numbers there at all?
I do.
And also big dollars saved on the criminal justice system, where we're now chasing after minor things and spending a lot of money in the courts and for OPP and other police officers.
So so I do have a figure here. So in 2017, total societal costs associated with drug use, such as opioid and cocaine, exceeded $3.5 billion in Ontario.
Yeah, so it's a worthy case then.
Yeah.
And I'm sure we'll see police budgets go down then and all those other things. Oh, that's a different story. Anyway, if there's no more questions or comments, thank you very much for the presentation, and I'm sure it will be supported later on.
Okay, well, thank you very much for your time this morning. I'm very appreciative of that, and I wish everyone a great day.
Thank you.
Thank you. Bye-bye.
Thank very, very much, Susan. Keep up the good work there.
Thanks, Dennis.
Then we will move into Committee of the Whole.
Moved by Councillor Higgs, seconded by Councillor McDonald, that Council adjourn and meet as Committee of the Whole Council with the Deputy Warden in the chair.
All in favor? Carried. Go ahead.
I better
Dennis.
unmute. I better unmute. Thanks very much. We have our first briefing this morning from Kelly Pender. So Kelly, it's yours.
Thank you, Deputy Warden. Just let me share my screen here and we'll get going.
And put your excellent presentation up.
There we go. So just, it struck me while Susan was speaking there that, you know, our paramedics have been working at the CTS for a number of months now, and the daily stories that they tell and how poignant that is and how relevant it is for our community. So a shout out to our paramedics as well. It's also been 14 months, and I think Warden Smith and I were at a meeting in Livingston, Addington County on March the 13th last year when the pandemic really hit hard, and it's been 14 months for, you know, our citizens and staff, and it's been a difficult 14 months for everybody, and hopefully you know, the end is around the corner, and just urge everybody to get their needle and let's get on with life. And without a golf course, my backyard is looking amazing. So I think the gardener took last summer off, but he's been busy at work this year. So thank you, everybody. And as usual, I'll touch on a couple things on each slide, but certainly available to answer any questions as we go through it. Deputy Warden, if there are any questions now or at the end, and if we can't answer them, we'll certainly get back to everybody. A fairly busy month, and my life has been Zoom over the last 14 months and continues to be that way. Did have one thing I'd like to draw your attention to is the Advantage Ontario meeting on May the 6th. Myself and representatives from the Eastern Ontario Wardens Caucus and KPMG presented to the Advantage Ontario annual convention about our study of long-term care in Eastern Ontario. And there's lots of terrific feedback on that. And our presentation this morning, Susan is going to give you an overview of the results of the Long-Term Care Commission. And I think it's safe to say that a lot of recommendations that came out of the Long-Term Care Commission and the Wardens Caucus report are in alignment and being taken seriously by the province. So last Friday we had an Eastern Ontario Wardens Caucus meeting. It was a long day. We also met with the MPs from Eastern Ontario to give them an overview of our priorities, beginning preparation for the AMO conference in August and setting our priorities, and also received an update on the cell gap project from EORN. And as we'll note in another slide or two, there is an opportunity for Frontenac County councils to get an overview of how it's going to roll out in Frontenac County in a couple of weeks, and be your opportunity to understand how it's going to roll out in our county and how it's going to affect our residents. So that is on June the 23rd at 5 p.m. via Zoom, and I urge everybody to participate in that meeting, and of course all your local council members as well.
Kelly, just on that, they'll strictly be covering the cell gap problem, and I don't think they plan to talk about the 1 gig project there.
No, this is actually Rogers that's presenting. So Rogers won the contract for the cell gap project, and they provided an Eastern Ontario overview to the wardens last Friday. And this one will give you an overview of the East, but then zoom in on Frontenac County just to give you a sense of, the number of cell towers and the extent of the project. So it's just the cell project at this point. Then Eorn will be updating us on the gig project over the next few months. Communications front, continue delivering a lot of products through social media, and our #1 social media product over the past month was talking about personal protective equipment and paramedics, and it was a wonderful video illustrating what a paramedic goes through prior to your call. And if you haven't had a chance to view that, I'd encourage you to do so. Also had a lot of activity with our Dark Sky Week in North Frontenac, and our Bang the Table community engagement project that we're doing jointly with all 5 townships, or with 4 townships in the county. So 5 different sites all integrated into one is up and live, and urge you to go there for our community outreach projects, and your township staff and county staff will be promoting that as projects go live. Planning department update, like building products. I heard on CBC this morning about the demand for building products, and it's certainly driving demand in planning world. A number of subdivision activities. The official plan for Central Frontenac is in the final steps. Had a local planning appeal tribunal hearing in North Frontenac that our former manager Megan Ruckwald participated in. Frontenac Islands is looking at their development charges bylaw, and of course the Communal Services Governance Committee report has been presented to all 4 townships, and we have 3 in agreement, and South Frontenac will be hosting a meeting to deal with it in more detail in the next couple of weeks. So making good progress on all of those activities. Up to 14 applications in North and Central, which again is a busy month for our planning staff, and 3 on Frontenac Islands. The number of inquiries continues to be strong across the entire county, and a large percentage of the applications over the winter were deferred because of septic inspections that can't be done in the winter. So the application and paperwork gets done and they get finalized, and obviously as spring comes, those get in front of your local township councils. Just in terms of HR updates, we continue to be very busy on the recruitment front.
Can I ask a question?
Oh, Deputy Warden, I think there's a question.
Sorry, internet delay,
Yeah.
Kelly.
Oh, I vaguely hear.
That you just showed. The last slide you just showed, Kelly, is it the number of applications, and you're saying that there's a lot of interest going forward, and been doing a lot of staffing at the planning department. Do you feel there's enough staffing to address the needs going forward?
Is Joe online? I defer to Joe. Certainly, I think we're in a better position than we were a year ago this time, but I defer to Joe if he's online.
Yes, Kelly, yes, I am. Through you, Deputy Warden, to Councillor Higgins. Certainly, because Council gave us the budget to bring in a new planner, it's making a difference in terms of us being able to handle those files. So if you look at this chart right here, 28 applications for North and Central. So now we have 2 planners working on those files, plus the manager, which is streamlining the process. It is making a difference, and it's also going to let us be able to pick up some of the bigger projects. Like next year, we're hoping to start the update on the Frontenac Islands official plan, as well as update the county plan. So it's very, very much appreciated that we have that other planner.
Thank you.
Thanks, Joe.
And just to build upon that slightly, the number of inquiries, and as a general rule, you get 10 inquiries will result in 5 applications, but those inquiries can be as complex as some of the applications. So it, if you see 28 and 331, that generally means that, they've had over 60 different planning inquiries as well, so, which is something we track and report to Joe on as well. So. Through May the 6th, we've completed 217 competitions for jobs. So our HR staff has been extremely busy. That number is more than what we would do in an entire year a couple of years back. Obviously being driven by the pandemic, the hiring of paramedics, part-time paramedics plus paramedics for the community paramedicine program. And in long-term care, the restrictions on 2 sites have meant that we've had to hire more staff, and so we continue to be busy. And also 12 different investigations have been completed by the HR department through May the 6th as well. So. The admin office project approved in principle by the CRCA, and I think we mentioned this last month, so we're on to detailed design and estimates. Material costs continue to increase. In preparation for the site plan amendment with the City of Kingston, the city has asked for a road widening along Battersea Road. So instead of just doing a site-specific survey, we're doing the entire property line along Battersea Road. The field work for that has been completed. We anticipate that we'll have the draft plan for review with the city in the next week or so. We've also been asked to do an archaeological study for the area to make sure that there are no archaeological remnants, and that should be completed in the next couple of weeks as well. So as soon as we have that work done and we know where we stand with the city, we'll have another admin task force meeting. So might be June or more likely July at this point before we're on to the next phase. So with that, Deputy Warden, if there are any questions, certainly available to answer those.
Do we have any questions for Kelly? And we're going to hear more on the report on senior care home. I found that kind of overwhelming with something like 87 recommendations. I guess we'll have to get inside and lower those by a great number if we're going to focus on a few. Any questions, folks? Okay, well, we'll thank Kelly for the presentation, and we'll move on to Allison, who's going to brief us on the Open Farms program for 2021.
Morning, everybody.
Good morning, Allison.
Can you see
got the floor?
Can you see
yes,
my screen?
I've got it. Yes.
Perfect. And am I in presentation mode? Is that how you're seeing it?
Yes.
I do see the first slide and the other slides on the left column, so I presume you are.
Okay, let me just see if I can. There we go.
There. Okay.
Perfect.
That's
Okay, thanks everybody. Good morning, Deputy Warden Doyle and Council. I'm going to chat with you briefly about Open Farms this morning, just to basically let you know that it is happening. We are planning ahead for it. In case there's any operators in your communities who are interested in getting involved, you'll have the highlights and know what's going on. So we are looking at the same goals as always. So these are the same 5 goals that have driven the event so far and will continue to drive the event moving forward. The first one we've reworded slightly this year. It used to be more specifically about our reputation as a region that produces good food, and it's expanded this year a little bit to being more about our region as a local food destination. And I'm going to loop back around to that a little bit later on. This is the draft, and I emphasize that word, draft schedule for this year's event. We're planning for a hybrid event, so combining virtual and in-person components. And there's lots of work to be done here to confirm all of these components, but this is what we're working toward now. Some virtual, some in-person, some new, some of the old stuff. Obviously, farm tours are still going to be a cornerstone of the event. But looking forward to this pretty dynamic schedule. There's lots of details in the CDAC report that went last week. So if you're interested in diving into those, you can certainly do that there. Also new this year is partnerships. So this was one of the directions that County Council gave us after the 2020 event, was to pursue partnerships. And we have done that with quite a lot of vigor, actually. And we've confirmed partnerships now with South Frontenac Township and with Tourism Kingston, sort of formalized partnerships. So I'm working closely with Amanda Pantry at South Frontenac, and she's helping me really bring to life that Centennial Park component. And then also working with Tourism Kingston, who has come to the table with a bit of financial support, but also staff support and, of course, their marketing expertise. So we think with Tourism Kingston's partnership, we'll be able to reach a significantly wider audience this year, which is pretty exciting. And then at the bottom there, you can see I've got a list of some of the other organizations that I've spoken to, all of whom are quite interested in either getting involved or supporting however they can this year. So really looking at sort of the expansion of Open Farms as a regional event this year, with lots of players at the table, which will be exciting. So we've applied for the Reconnect Festival grant this year for a bit of cash to help with the event. And you can see I've got their announcement expected in quote unquote early summer. So I don't know exactly when that will be, but fingers are crossed that we'll get some funding. And the plans, as I outlined in the previous slide there, do depend on that funding. So if we don't get it, we've identified this as one of the risks. If we don't get the Reconnect grant, then obviously we'll be a little bit limited, and we'll have to pull back a bit. So either putting some upper limits on the number of people, number of farms who can participate, or potentially rolling back or scaling back on some of our components. And then the other risk that we've identified is a fourth wave of COVID-19. So obviously, if we get to a point where gatherings are limited or impossible, then we would either scale back or cancel our in-person components, and then scale up the virtual components. You know, last year we executed a completely virtual event, so we can do it if we need to, but certainly we'd like to have some in-person components if we can. And then we have started an open dialogue with KFLNA Public Health, and they have told us that they think planning for an outdoor event of this scale and nature at this time of year is reasonable. And I think the more we see case counts decreasing and vaccine rollout ramping up, that feels more and more reasonable. But of course, we're keeping that open communication. And then their advice, which I am heeding certainly, is plan for the best and prepare for the worst. So moving forward with some contingency plans in place if those risks should arise. So then looping back to that first slide when I talked about the goal of establishing or cementing Frontenac and our region as a local food destination, we really see Open Farms as a driver of sort of the long-term vision around a local food destination. And some of those things would be what I've outlined here on the slide. So, farmers would see Frontenac as a desirable region to establish new agricultural operations. The region would see increased interest from food and beverage businesses because we have a thriving local food industry. And that might mean new food and beverage businesses who either establish in Frontenac or relocate here, or maybe it means food and beverage businesses from other parts of the province who work with producers in our region because they're high quality, producing great food, really great to work with, those kinds of things. We also see Open Farms as a driver of new culinary and agritourism products, and that those products in turn increase the viability of established and new agricultural operations so that existing farms or new farms can offer agritourism products as a way to generate revenue and ensure their long-term viability. And then the last point on the slide here is that we foresee visitors wanting to travel here specifically for experiences related to local food. So sort of building their visit around those experiences. So that's my whole presentation. Those are the highlights that I wanted to bring forward for council, just so that you had an understanding of where we're going and how the event's evolving. I don't know if anybody has any questions. I'd be happy to answer them now. Otherwise, that's it for me this morning.
Thanks very much, Allison. Does anybody have any questions? No questions for Allison. Very good presentation. It's so clear that and looking forward to those September programs. And we're pretty sure at the health unit that we will be under some method of opening well before then. So
Wonderful.
we'll be in
Thank you so
touch.
much. Okay.
Yeah, thanks very much. And now we have Kelly and Susan on again to discuss the long-term care home. So Kelly and
Thank you,
Susan,
Deputy
you have
Warden.
the floor.
I'll just provide a bit of an introduction, and then Susan can go through the details and the more specifics, and probably answer Frontenac related questions. So as the Deputy Warden mentioned, it's a pretty beefy report. It's 322 pages. It's actually heart-wrenching to read. The detail that the commission went into is very dramatic, and it is, much of it is spoken from the residents and families' perspectives. So even if you just read the executive summary, I think you'll get a sense of the amount of time that the commission put into preparing this report. With respect to the recommendations in the report, as the Deputy Warden mentioned, they are quite comprehensive. In Schedule A to the report, we have provided a comparison to those recommendations and the Eastern Ontario Wardens Caucus recommendations. So you can do a little bit of a side-by-side. So the Wardens Caucus recommendations came in 6 different areas, and they're detailed on the first page of Schedule A, just as a reminder. So I think it's important to remember that our number one priority has been the health and well-being of the residents. So the Schedule A also provides, in yellow highlights, some of the aspects that apply most particularly to Fairmount. So with that, Susan, if you want to put the slide deck on and go through the slide deck and give council an overview, and we'll both be available for questions at the end. Thank you.
Good morning. Is everyone able to see my screen?
Yep.
Just looking to confirm you're seeing the presentation mode of the screen. You're not seeing the slides on the left. If you could confirm, please.
Yes, we are.
Yes,
Susan.
we do.
So if you can just
So
go
you
out
have
and
Why can I not see it? Okay. So you are still seeing the
Yeah, we're still not quite there. Must be something you clicked on. I know Allison and Susan had to click on something to get theirs up as well.
right, and I did that, and it's unfortunately it's using multiple screens, I think, is my challenge.
I think if you just minimize the other ones, Susan, it'll be fine.
Okay. Enough trouble is I have far too many open. I'm assuming you're seeing my main screen at this point.
We've got the slides on the left and the first slide in the center.
Okay. Well, maybe I'll
Nice
work.
pictures of your family and all that. Just kidding.
Well, maybe I'll work with what you can see at the moment. So you can see the first slide and you can see the subsequent slide. If you could just confirm that's what you're seeing at the moment.
That's correct.
Okay, thank you very much. So
if I get a magnifying glass, maybe I can read the other one.
well, thank you very much, Warden and Council, for the opportunity to discuss the Ontario Long-Term Care Commission's final report this morning. So I'll start with a discussion on, if it'll allow me to move to the next slide. Okay. Are you seeing the second slide? The Long-Term Care Commission investigation is at the top of your screen?
No, we have just the first slide and the about 4 other slides on the left column.
Okay.
In miniature form.
This is
Susan, if you just click on the second slide, it'll pop it up. There
Okay.
you are.
Okay, super. Thanks very much. Okay.
Oh, there you go.
So, as you're aware, coronavirus COVID-19 emerged in Wuhan, China in late 2019 and evolved into a global pandemic that was declared in March 2020. The COVID-19 virus devastated the elderly in congregate living areas, including the long-term care homes. As outlined in the final report, approximately 61% of all COVID-19 deaths in 2020 were long-term care residents. And by April 2021, approximately 4,000 residents and 11 staff in long-term care had died from the virus. In the summer of 2020, the province of Ontario created the Long-Term Care Commission, the Long-Term COVID-19 Care Commission, to investigate the spread of the virus in long-term care, its impacts on residents, staff, volunteers, and family members, and to provide recommendations to prevent future spread of disease in long-term care. The report outlines the state of the long-term care sector and the pandemic preparedness before the virus. So the long-term care investigation started in September 2020 and completed in March 2021. The investigation was completed by hearing from residents, families, staff, hospitals, public health units, inspectors, licensees, operators, government officials, experts, advocacy groups, and many others. The report outlines the actions and inactions that contributed to the devastation experienced in long-term care during the pandemic. The report contained two interim reports, or the commission issued two interim reports, the first being in October 23rd, 2020. That interim report focused on the urgent need for additional long-term care staff, increased resident care, and supporting the strength of the health sector in collaboration with long-term care. The second interim report, which was released on December 4th, 2020, focused on effective leadership and accountability in the long-term care homes and an expansion of performance indicators and a reintroduction of comprehensive annual inspections of long-term care homes and enforcement of any violations within those homes. So findings from the report included that a strong recommendation or a strong factor that the provinces was not prepared for the pandemic, as were some of the long-term care homes. For example, in 2003, there was an outbreak of SARS, which led to the development of several reports that outlined what was needed from the province to be ready for a pandemic. Again, H1N1 and Ebola led to, again, the need for emergency preparedness with no lasting efforts to ensure that the province was ready for the pandemic that we are currently in. As the years progressed, pandemic preparedness seemed to cease as a priority. And by the time COVID had came into Canada, 90%, or into Ontario, 90% of the province's stockpiled PPE had expired and was slated for destruction without any plan for replacement. Many of the challenges in the long-term care sector had existed for decades, including chronic underfunding, severe staffing shortages, outdated infrastructure, and poor oversight, which were set aside for other fiscal priorities and policies. The infrastructure in many long-term care homes today are outdated and not up to date with the province's current standards, which are from 2015. And so containing a virus in some of these settings, including in settings where they had 3 and 4 bed ward rooms, was very difficult to contain the virus. The long-term care workforce was already stretched to its limits before the virus COVID-19 came into Ontario. And over the last decade, as you're aware from business plan presentations, there's been several government commission reports and advocacy group reports that have pointed that additional staffing was required due to the high acuity of residents in long-term care homes. Yet there was no plan to support this surge in labor shortage that was to come prior to COVID-19. And in addition, it's come to light that many long-term care staff did not have the crucial training in infection prevention and control that is necessary for any outbreak in a long-term care home. So just touching base on the final recommendations, which, as Kelly pointed out, most of them correspond nicely with the EOWC their long-term care report as well. The commission had 85 recommendations, some comprehensive, but I'll just give you a sense of the categories that those 85 recommendations would fall into, with the first obviously being pandemic preparedness of both the province and the long-term care homes, addressing the after effects of this pandemic on the residents and the staff in long-term care homes, infection and prevention control standards and training that is required, healthcare system integration, improved resident focused care and quality of life, addressing the human resource challenges, including improving working conditions, compensation and training of staff, and regulating PSWs, enhancing the oversight of the medical director, increasing long-term care operational and capital funding, increasing accountability and transparency in the long-term care sector, including the need for public performance indicators and standards, comprehensive compliance and enforcement. And with the last being that on the first and the third anniversary, the Ministry of Long-Term Care is to publicly report on the implementation of the recommendations that are being provided in this Long-Term Care Commission final report. And just to touch base on the future, or what the commission sees as far as the future in long-term care, there is an increase in complexity of resident care needs, and the current provincial funding has made it difficult to provide the required level of care for long-term care residents. The residents have more medically complex needs and require more assistance, extensive supports actually, with their activities of daily living. The funding model of CMI, or Case Mix Index, as you're aware, provides funding that's based on retrospective data of resident care needs that were from 2 years prior. So the current funding is not based on the acuity level of the current residents in the home. And demand for long-term care in an aging population is putting pressure on an already overloaded long-term care system. And as previously mentioned, the staffing shortages are not new. The excessive workloads, we have high turnover rates and a reliance on part-time workers. So what they're seeing for the future is, with an increase in aging population and the inadequate long-term care infrastructure, there will be a demand for an increasing demand for long-term care spaces and staff in the years to come. And thank you for your time and attention today. Do you have any questions?
Yes, thanks very much, Susan. Could you take your slide down so that I can see everybody on the screen?
Certainly.
Thank you. There we go. Yes, Warden. Got a question?
Well, the only question I have, I guess, is if funding is 2 years behind, did we get any extra COVID funding to help with this year?
We certainly did. Yes, we've gotten extensive supports from the provincial government to support the increase in staffing, particularly with, as Kelly mentioned, the requirement that they can, the staff could only work in one long-term care home. That meant for Fairmount, we lost approximately 40 staff once that legislation became in place. So yes, they provided supports for PPE. They provided supports for staff. Pretty much they've helped fund us through this current situation. It's looking at the long term.
Right. Thank you.
Thank you. And Councillor McDonald.
Yeah, through Deputy Warden to Susan. Susan, are the training facilities like St. Lawrence College and other educational institutions, are they being asked to step up their training facilities? Because we do know that there's a shortage of, for example, PSWs in the industry right now. Do you see any hope that there will be additional training opportunities for young people to join the force?
Absolutely. They have increased the PSWs as well as nursing as well. And they're actually funding some of that training to encourage participation and more people to enroll. So they are certainly looking at supports and how they can encourage people to get into the profession.
Thank you. Can people hear me? My screen seems to have frozen. I can't see any new hands going up.
I've been raising my hand. I guess you haven't seen it, Dennis. It's Councillor Higgins here. I have 2 questions for Susan. Susan, thank you for your report. I wonder if you could give Council a sense of how Fairmont compares to the overall report, for one thing. I have my own personal view is that we're doing quite well. other than the funding and the staffing shortages. Is there anything in those recommendations that pertain in particular to Fairmont Home?
I would say that there are a few, and there are some things that we can improve upon, and we are, as a management group, looking at those recommendations and how we can move some of those forward. But I support exactly what you've said, that Fairmont is doing very well, has done very well staffing wise and able to recruit staff. You know, our HR department has been very dedicated throughout this pandemic and in assisting the home. And I would say our compensation as far as the municipal sector is more in line. We're still, you know, wage parity with hospitals are still there. You know, if a nurse can work at a hospital and make an increased income as opposed to long-term care, I think that's something that maybe the province needs to look at. So, but no, I agree with everything you've said, Ron. We are doing well in comparison to perhaps some rural or remote areas who may not be.
Thank you. My second question is, in the report, is there any differentiation in the recommendations between profit and not-for-profit long-term care homes?
I would say they tried to perhaps not generalize those recommendations that way. They're trying to look at what applies to the sector as a whole. There are some general comments within it that, you know, differentiate between the different business models for long-term care. But given the current need for long-term care and the increasing need coming forward, I think all sectors need to work together to try and meet that.
Okay, thank you.
Oh, and Jerry, Mr. Councillor Martin.
Well, Dennis, through you, I have a question for Susan, I guess for Kelly Pender as well. We sat at meetings about a year and a half ago now. We discussed an expansion of bids for Fairmont Home, like another pod. Has that discussion just stopped, or have we had any more discussions among staff about that? I guess that's to you, Kelly.
We haven't, Jerry, but the Long-Term Care Commission report sets out a different path for bed expansions. I think everybody recognizes that you know, with the aging society that we have, that we're going to need more beds. So the Long-Term Care Commission recommends that expansions and new builds be done by the private sector, but managed by a municipality or not-for-profit. So I think until the province sorts through how that's going to happen, most of the industry is just standing still. The experience in Eastern Ontario, Leeds and Grenville, Northumberland, Prescott Russell are all in various stages of either expansions or rebuilds. And you know, the recommendations in the Warden's Caucus and in the Long-Term Care Commission is such that, you know, there just isn't enough money in the system to make it worthwhile to expand at this point. So I think we're all just waiting for the province to figure out what the model is going to be moving forward. But there certainly is the demand. Fairmont is either first or second, depending on the month you look, in terms of most demand in the old Southeast Lynn. So there is a large demand for our service, but there just isn't the money in the system to provide for the capital.
Okay, so nothing really has changed in that regards in the last 2 years. That's good. Thank you, Kelly.
People may have noticed I have internet problems. Anybody else got a question? Well, very good. Thanks very much, Susan. It's an overwhelming report, so I guess we have to start nibbling away at it, and it's going to take years to implement all, but I think we're probably in better shape than a lot of long-term care homes, so I guess it would be interesting to find out just how many of those 85 recommendations that we're well ahead on solving, like the 4 hours of care and so on.
Okay.
Well, let's move on then.
Thank you.
Thank you. And we've got a resolution, I believe, Jeanette?
So we're into the recommend reports from the Chief Administrative Officer.
That's
So
right. Yeah.
the first report there is the authorization to enter into an agreement with the province of Ontario, and that is moved by Councillor Revel, seconded by Councillor Martin. Be it resolved that the Council of the County of Frontenac authorize the warden and clerk to execute an agreement with Her Majesty the Queen in right of Ontario as represented by the Minister of Long-Term Care for COVID-19 resilience infrastructure stream funding for the Fairmount Home HVAC replacement and disinfection system should the application be successful. And further, that the Council of the County of Frontenac authorize the warden and clerk to execute an agreement with Her Majesty the Queen in right of Ontario as represented by the Minister of Infrastructure for COVID-19 resilience infrastructure stream funding in support of the Frontenac Administration Office reception redesign should that application be successful.
Any questions on that resolution? I'll call the vote in reverse. Does anyone plan to vote against it? I think your face is frozen on my screen. Can anybody hear me?
Yes.
Yeah, okay. So the resolution passed. The next resolution is from Corporate Services on the bylaw monetary penalty. Do you want to read that one, Jeanette?
Yes, that is moved by Councillor Higgins, seconded by Councillor Smith. Resolved that the Council of the County of Frontenac receive the Corporate Services bylaw for the provision of administrative monetary penalty process report for information, and further that Council pass a bylaw later in the meeting to establish a process for administrative money penalties.
Thank you. If anybody's got any questions, please speak up because I can't see you.
Deputy Warden, it's Councillor Higgins. I do have a question.
Go ahead, sir.
Yeah, I just wanted to ask, what bylaws does this actually pertain to from a county level? Because I understand it's not allowed for public works type of or planning activity. So I'm just wondering which bylaws this would pertain to in our instance.
So through you, Deputy Warden. This is just the bylaw to establish the monetary penalty system. We would need to update specific bylaws to work with this bylaw. So for example, we would be able to update our fees and fares bylaw for the Howe Island Ferry to establish offenses and monetary penalties. And then we use the monetary penalty bylaw or the AMP bylaw in order to provide the penalty notices. So this bylaw itself just establishes the ability for the county to do an AMP penalty notice.
Thank you for the explanation. Any other questions?
Yeah, I just wanted to follow
there's no
up
other
on that,
question.
Dennis. So wouldn't it apply to, so it only applies to Howe Island Ferry as far as bylaws go from the county on monetary penalties then?
So through you, Deputy Warden Doyle, it would apply to any bylaw that we update to be designated under the AMP bylaw. So each bylaw that we update would get designated under the AMP bylaw. And I'm not sure if the CAO has anything that he needs to add.
Another good example would be the trails bylaw.
That?
Thank you, Deputy Warden. Another good example would be the trails bylaw. So we've got trailheads. This would apply to parking, speed limits, enforcement, those kinds of things. So it's a simplified process that allows for the monetary penalty. But as each bylaw comes forward, council will consider whether the AMP process is applicable. But certainly the trails bylaw and Howe Island Ferry are the two that we envision happening over the next few months.
Okay, thank you. And that clarifies. Thank you very much.
Thank you. If there's no more questions, I'll ask if anybody plans to vote against this resolution that you speak up. Having heard none, the resolution passes. The next on the agenda is information reports. Any questions on those information reports? Having seen none, I'll move on to reports from the liaison appointees. It's actually the outside committees and boards because we're not doing the liaison today. Councillor Ravel, do you have a report on the library?
Not really, and frankly, I must apologize that I'm not sure I've followed the protocol appropriately for sending in those reports in writing ahead of time. I'm not sure that was actually adopted by council, but I have actually very little to report. We have a library board meeting this afternoon, and we're still working under the restrictions of the province, but there's still curbside pickup, and things seem to be moving fairly smoothly. Thank you.
Thank you very much, Alan. And the next report is mine. And the mayors who called in on the Monday meeting may have heard of some of this, but we do have over 98% of the 80-plus-year-olds having their first shot at this time. And we're doing extremely well in over 60s as well, with over 90% immunized. And that's as of Monday. And on Monday, we had approximately 45% of Ontario's adults receiving their first shot, while we had at that time surpassed 50%. So I want to thank everybody in the region for stepping up to get their vaccination as they become available. And we're increasing at about 1% a day now in our region. So by the end of next week, hopefully we'll have over 60% with the first shot. And this week opened up to 18 plus people can book their appointment. And at the end of the month, on May 1st, we'll be adding the kid 12. Over 12 years of age. So that's my report, and thanks for the ongoing support. And we really have more weeks of it, but we are making. And the next, any questions on that? No, and none. Housing report from Fran Smith. Fran?
No report. There's been no meeting.
Okay, thanks very much. And a report on the Food Policy Council from Councillor Higgs. Go ahead, Bruce.
Yes, I was told that we weren't making reports, so I don't understand exactly what I was supposed to do. We did have a meeting.
Oh, we're not making liaison reports from the internal, but we're still the outside. But I think there's a resolution on that later in the meeting to clarify. Oh, okay, so we'll move on then. And reports from advisory committee, we've done that. Community Development Advisory Committee, there's a resolution.
Yes, Deputy Warden, through you. That is moved by Councillor McDonald, seconded by Councillor Higgs, that the report received from the Community Development Advisory Committee be received and adopted. And there are two items on that, which is the May 2021 update on COVID-19 response initiatives and the Open Farms 2021.
Okay, so any questions on that? And having seen none, I'll call the vote by asking if anybody plans to vote against, and please speak up. Having heard none, I'll call the vote passed. And I believe now we return to council.
Moved by Councillor Martin, seconded by Councillor Revel, that council revert from committee of the whole council to council.
Anybody against that? Having heard none, Mr. Warden, the meeting yours.
All righty. Adoption of the report of the Committee of the Whole.
Moved by Deputy Warden Doyle, seconded by Councillor Higgins, that the report of the Committee of the Whole Council be adopted and that the necessary actions or bylaws be enacted.
Anyone opposed? Carried. Notices of motion.
So in terms of amendments to reports from external boards and committees, it's moved by Councillor Higgins, seconded by Councillor Smith, whereas bylaw 2018-0040 appoints members of council and members of the community to external boards and committees for the term of council, and whereas members of council appointed to external boards and committees receive agendas and minutes of meetings of these external boards and committees, therefore be it resolved that the requirement for councillors appointed to external boards and committees to verbally report monthly to council on the activities of the external boards and committees be removed unless there is something that needs county council support, and further that external boards and committees be requested to forward their meeting minutes to the clerk to be included in the Friday council distribution package.
Comments? All in favor?
Yes.
Carried. Community drug strategy.
That is moved by Deputy Warden Doyle, seconded by Warden Vandewall, whereas the Kingston, Frontenac, Lennox and Addington Community Drug Strategy Advisory Committee supports the call for the decriminalization of people who use drugs, which is an evidence-informed approach that will address the unrelenting overdose crisis in our community and will position drug use as a health issue rather than an issue of morality, willpower, or criminal justice. And whereas the KFLNA CDSAC is a cross-sector planning table that includes service providers from health, social services, and enforcement sectors and individuals with lived experience of substance use. And whereas the KFLNA Board of Health at its meeting held on April 28, 2021 passed a motion supporting the KFLNA Community Drug Strategy Advisory Committee's statement of support for decriminalization of people who use drugs, as well as requests that Kingston City Council, Frontenac County Council, and the Council of the County of Lennox and Addington also consider endorsing it, recognizing that the opioid crisis continues to devastate communities across Canada, including locally in KFLNA. Therefore, be it resolved that the Council of the County of Frontenac endorse and support the KFLNA Community Drug Strategy Advisory Committee's statement of support for decriminalization of people who use drugs, and further that a copy of this resolution be sent to the Honourable Patty Hajdu, Minister of Health, Government of Canada, with copies to Mark Garrettson, MP, Kingston and the Islands, Scott Reed, MP, Lanark, Frontenac, Kingston, Derek Sloan, MP, Hastings, Lennox and Addington, His Worship Brian Patterson, Mayor, City of Kingston, His Worship Rick Brzee, Warden for the County of Lennox and Addington, Loretta Ryan, Association of Local Public Health Agencies, and Dr. Kieran Moore, KFLNA Public Health.
Any discussion? All in favor?
Yes.
Carried. Food literacy.
That is moved by Councillor Higgs, seconded by Deputy Warden Doyle, whereas the policy briefing note for Bill 216, the Food Literacy for Students Act 2020 has been finalized, and whereas the policy briefing note examines the concept, desired competencies, and links and gaps of food literacy, as well as sets out recommendations, considerations, and opportunities for rollout, and whereas the policy briefing note will be sent to the Food Policy Council of Kingston, Frontenac, Lennox, and Addington's government contacts in lead up to the standing committee hearings for Bill 216. Therefore, be it resolved that the Council of the County of Frontenac formally support the policy briefing note for Bill 216 and have the County of Frontenac added to the list of supporters.
Any questions or comments? All in favor?
Yes.
Carried. Anyone giving notice of motion? Seeing none. We have all the communications there. Anybody have anything on there they want pulled out or? Other business? Public question period? bylaws.
Moved by Councillor Higgins, seconded by Councillor Smith, resolved that leave be given to the mover to introduce bylaws A through E that have been circulated to all members of County Council, and that bylaws A through E be read at first and second time.
First and second time, all in favor? Carried.
Moved by Councillor Higgins, seconded by Councillor Smith, resolved that bylaws A through E be read a third time, signed, sealed, and finally passed.
Any comments? All in favor? Carried.
Moved by Councillor Martin, seconded by Councillor Revel, that the meeting hereby adjourn at 10:42 a.m.
Anyone opposed? All in favor? Carried. Thank you.
Remember, folks,
Have a good
cheerful
day.
Leafs.
Go where?
Thanks.